Well, Happy New Year. My name is Steve Jackson. I'm the Senior Vice President, Strategic Development and Channel Sales here at PrimePay. And as I had mentioned earlier, we're thrilled to have you. Each month, to some degree, I almost feel like we would run out of content to some degree from month to month, and what are we going to talk about? Well, I will say that since March of 2010 and ACA, there has been no relief in the amount of content that we can provide. There's always plenty, and this webinar for this month is really no different. We wanted to focus on some key guidelines that were published at the very end of the third quarter into the fourth quarter, and several things that were published here in the fourth quarter that we really should discuss with you. And so we're focused here a little bit on HRAs, FSAs, and PRAs because of the types of questions that we have received from our broker partners. But as we look at the agenda, you're going to notice here that I've got a few different things listed. So one of the first things that we will discuss, which has been, again, very confusing, I think, for many of our broker partners, just for many out there. You hear a lot of conflicting information, and we hope to put that to rest here today, at least help reduce the amount of confusion that you may have surrounding this, but using pre-tax benefit accounts for individual medical premiums. We then will talk about the accepted benefit rules for your health FSA. Very important to discuss. Something that you can take right away to your clients and have actually a strategic discussion with them just about that accepted benefit rule for health FSAs. Thirdly, the FSA rollover provision impact that was announced on Halloween. So we need to share at least just some nuts and bolts as far as what that means. Also, what you can do today with your employers in regard to premium-only plan amendments. Are there some things from an ACA perspective that you need to look at or may be required for employers in regard to their premium-only plan? We always try to follow up on a practical basis with just some next steps for you. I do have one question for you that I will ask near the end, so just stay with me there, and we'll send out a poll question there at the end of the webinar here for you. And then again, as time permits, we'll do look at questions, try to provide some answers if we're unable to. Certainly we're going to provide that in feedback to you as follow-up over the next couple days. All right? So, if you're much like the Jackson family, like my family, as we traveled over the holidays, one of the questions from my children, what do you get? Are we there yet? Are we there yet? Yeah. And you guys can all say it together with me in your response to your children. We'll get there when we get there, right? So that's a common phrase, at least in the Jackson family. But as we look at ACA, we look at just the last, the previous 2 years, 2012, 2013, and as we go here into 2014, where the largest breadth of the regulations and requirements for ACA are going to be impacted in 2014. As we ask this question, are we there yet? We're not there. I mean, we're not certainly there yet. We clearly have the individual mandate that is impacting, many, right? Right now here in 2014, there was certainly the delay in the employer mandate here for 2015, but that does not give us pause as we talk with our clients. It actually just provides maybe at least more reasonable time to consult with our employers and provide strategy in regard to how the employer mandate is going to affect, them and certainly all of your groups. But then as you go into 2016, 17, and 18, we end roughly, I say end, with my bunny finger quotes, in 2018 with the Cadillac tax. But who knows, right? If things are delayed or pushed on from there, are we there yet? Not quite. We've come a long way. There's been a lot, as you can see, just in 2012 and 13. There's been a lot. But I want to focus on, at least our attention here today, on a very important topic that we discussed quite a bit in 2013, and it's surrounding the reimbursement of individual medical premiums, okay, with, generally speaking, from pre-tax benefit accounts. How can I establish a tax-advantaged program for my benefit offering in reimbursing employees of their individual medical premiums? And so what I want to address are 4 issues along with 4, in essence, solutions affecting these HRA and PRA plan designs. And this guidance came out here on September 13th of 2013, one from the Department of Labor, a technical release 2013-03, and then IRS notice 2013-54. Now these 2 notices were in response to the HHS guidance, which came out as an FAQ number 11 back in January of 2013. And when this information came out from HHS, I think we all, you included, all of us, were kind of scratching our heads saying, well, what does that mean? We're going to need further guidance. And so we had told you earlier in the year in 2013 that we were looking for continued guidance, and they indeed did deliver. Now, we can't sit here and say that we agree with everything that has been said. We love their opinion and love this new guidance. But what we do want to focus on are these key 4 issues. But the way PrimePay thinks, we want to focus too on the solutions, because at the end of the day, with regulations and legislation, all these requirements of ACA, there are some real specific solutions and strategies that you can implement with your employers. And so we want to focus on that positive versus just kind of what had come out maybe that looks like a negative. So let's look at issue number 1. So the first question that I'm going to pose to you is, do standalone HRAs meet the ACA's prohibition on annual dollar maximums and preventative benefits requirements, and can they be offered? Okay, so as you look to the left there in my little law script or scroll with the Affordable Care Act, there were 2 acts a part of ACA, Act 2711, which provided that a group health plan may not establish any annual limits on the dollar amount of benefits for any individual. Okay, that's right out of the code, 2711. Then you also had Act 2713, which required non-grandfathered group health plans to provide certain preventative services without imposing any cost-sharing requirements for these services, okay? So as I ask this question and as I pose it from an HRA standpoint, I'm reflecting on those 2 acts. So to answer this question, can they be offered standalone? The answer is no. Okay, so based on this guidance, so let's look here. If we understand what a standalone HRA, a health reimbursement, might be, it's where you are setting up an HRA specifically to reimburse individual medical premiums. Under federal statute, under 105, that has been permissible. But under these new guidelines, we do need to look at it a little different way. So what is the solution? If the answer is no for an HRA, what is the solution? Well, one, and this is a clear choice and one that many of you that are on the call as benefit professionals utilize each and every day and month with your groups as they renew or new groups. HRAs must be integrated with a group health plan, GHP group health plan that complies with ACA. So this is your standard HRA. This is kind of a no-brainer. Many employers today that have moved to higher deductible health plans many have incorporated an HRA to reimburse a portion or all of that deductible expense, based on the needs of the employer. Okay, HRAs that are used in conjunction with a group health plan or considered integrated will comply. And be a solution. So you can continue to use an HRA just like you have in the past. There's not a prohibition on that. And that has been one question that we've received quite regularly, whether it's a small group, large group, HRAs integrated with a group health plan, is eligible. Secondly, HRAs may be available to employees enrolled in non-HRA group coverage with another employer. Now, this was something that we actually laid out for you in our webinar in November of last year, but this is also a solution. So think of this, if you will. So under the ACA requirement, the employer, at least as we consider the employer mandate, you must provide coverage to 95% of your eligible employees, full-time employees rather, and you must cover your employee and dependents. It doesn't say to cover the spouse. And so there could be instances, or potentially instances, there's certainly been a lot of discussion around employers removing spousal coverage from their plan. So if employers do that, or if employees just decide, you know what, I appreciate your group health plan, employer, and I appreciate your HRA, but I'm going to enroll in my spouse's plan at another employer. All right, well, the HRA, the employer that is sponsoring the HRA, actually could establish the HRA to reimburse expenses, deductible expenses, co-insurance expenses, and so forth, expenses that were incurred from the other group health plan, from that other employer. So think of it like a little bit, kind of like a cash out option. If you had an employee that waived coverage, potentially an employer said, hey, thanks for waiving, I'm going to give you like $1,000, as taxable wages. Well, what if you establish it as an HRA? So one of the solutions here that was offered and granted, in essence, within these notices was the ability for an employer to provide HRA reimbursement on a tax-free basis for expenses incurred in another non-HRA group plan with another employer. Very interesting. We would love to hear from you as far as how that even might play out. Thirdly, a solution. So standalone HRAs, okay, they don't work. Okay, standalone HRAs. I can't reimburse individual medical premiums on a pre-tax basis. Well, you can create an HRA exclusively for accepted benefits, all right? So as you know, with ACA, there are certainly the non-accepted and accepted benefits. And so an HRA that is established or implemented to specifically cover the accepted benefits is a solution, is something that can be implemented. And one of those, just kind of looking at some of these names, retiree only, which I will go into just a little more detail shortly, dental, reimbursing dental premiums, vision, hospital indemnity plans, maybe possibly other limited or, limited major medical type plans can be reimbursed as well on an individual premium basis. Okay, so there are solutions. You could have an employer that is offering, insurance or not offering insurance, but an HRA that is exclusively set up for reimbursing accepted benefits is a solution. So let's look at actually one of those. So in this retiree-only HRA, so we'll go to kind of issue number 2 and focus this question specifically on, do retiree-only HRAs comply with these ACA requirements? Now, we are certainly seeing there, and you see a lot of news, right? A lot of the jumbo employers over 2013, there were several that came out and said that they were going to establish these types of benefit offerings under an HRA to accommodate their retirees. Well, there needed to be guidance here surrounding that. We see mid-sized employers that have retiree-only plans as well, okay? So, do retiree-only HRAs comply with these requirements? They do, yes, they absolutely do, but, all right, so let's tackle that here a little bit. So the first bullet point that I want to cover is, it is permissible, okay? So a retiree HRA is considered an accepted benefit, and so it is permissible under the ACA requirements. Secondly, though, a couple things to consider. So an employer that does adopt a retiree-only HRA, that retiree-only HRA does the following. Number one, it provides minimum essential health coverage. So within the guidance that came out in September of last year, it stated that this HRA, if provided to retirees, it is considered providing minimum essential health coverage, and since it does provide minimum essential health coverage, it prevents the retiree from obtaining premium subsidies. Okay, so if that retiree accepts that HRA, in essence opts in for that HRA, they would be able to certainly receive the tax-free benefits to pay for premiums as needed, but it would prevent the retiree from obtaining premium subsidies. So the one requirement that is needed in regard to this retiree HRA is that it simply needs to be able to, for that retiree to opt out of the HRA if they want to receive the subsidy. So that retiree might go into healthcare.gov, they might, try to get information about their plans and what it's going to cost, and if they feel they qualify or if they will qualify, they may want to opt out of the HRA, and they should be able to do so. So within the documents, there is a document requirement that an employer must be able to provide a opt-out of that HRA for those retirees. Issue number 3, and I want to move this specific issue as part of the guidance as it relates to current plans or a current plan. What do we do here? What if my current employer's HRA plan is reimbursing individual medical premiums? Now, as we saw these plans, many of these types of HRAs were in the smaller group market. I would say generally, under 50, right? As far as employers being able to provide some reimbursement for medical premiums. So let's look at that. What if our current employer's HRA plan is reimbursing? So let's look at some solutions. There's an action item and then a solution here that we want to touch base on. So the action item is this: employers can run out their existing HRA plan, okay? But at plan year end, these plans must be spent down or terminated. And I'm speaking of 2013 plan years, not January 1st, 2014, but those plans which started in 2013. So you can run it out, but at plan year end, these plans must be spent down or terminated, or lastly, amended, where the solution would be then to focus on whether it be on accepted benefits that that employer could provide. Now, it may be retiree only, but it could be something like ancillary only types of HRAs. So think of this: an employer generally who is offering reimbursement of individual premiums, not always, but generally would say that that employer is not offering coverage, right? So they're not offering anything. So, but they still need to attract and retain employees. They want as strong a benefit offering as they can afford and certainly provide. So what if that employer offered an HRA that focused on dental, individual dental or vision, or again, those hospital indemnity, limited medical products, things of that nature, or at least that employer is saying, look, I want to be able to provide you something. If you go and you purchase this individual dental plan or vision plan and what have you, I'll be able to reimburse you up to this certain amount. Okay, so that is one solution that can be made. In one respect, can an HRA reimburse individual medical premiums? No, medical premiums, but they are able to an HRA can reimburse ancillary only, or those benefits that fall under the accepted benefit rules. Issue number 4, our last issue here in regard to this specific topic, and I want to touch on the premium reimbursement account. Now, the premium reimbursement account falls under Internal Revenue Code Section 125. And I will say that as we began to, initially, before even HHS had come out with their guidance early last year, we really felt here at PrimePay that the premium reimbursement account offered the employer and employee the greatest amount of flexibility as it relates to reimbursing individual medical premiums. An employer can make a contribution, the employee can make different elections and contributions, and there was a greater amount of flexibility with this particular plan design, even over an HRA. So when HHS came out with their guidance, we were like, not a big deal, so much at that time. Well, this guidance in September then did focus specifically as well on Section 125 and the premium reimbursement account and just employer payment plans in general. And it focuses again on the same very acts as I had mentioned before, Act 2711 and 2713. So will premium reimbursement accounts under Internal Revenue Code Section 125 still comply with the ACA market reforms? No. All right, but there's always a good solution here. And these are some things that I want you to think about as outside the box here. So as you think about a solution for this, so if we had used PRAs, even through last year as an opportunity to reimburse individual medical premiums, but now we're unable to do so. So what can we do? How do we use a PRA, or what is another solution if I'm unable to do that? So although a PRA cannot be used to reimburse individual medical premiums, we do want you to think about some of these kind of three key things. Okay, one, you can still use the PRA to cover any of the accepted benefits. So think of this solution as actually, again, for both employers who do or do not offer group health plan coverage. You'll have employers that are not offering group coverage, but they might want to, again, like an HRA could use it to subsidize a portion of their dental premiums, vision premiums, other hospital indemnity plans, and so forth. So that employer that is still wanting to have a defined contribution amount go towards some benefits for the employee could consider making that contribution to the PRA, and then the employee could use those dollars to cover any of those accepted benefits. Okay, so that's one solution. On the second side of the aisle, you could still have an employer that is offering group health plan coverage, but again, maybe it is very high deductible plans, it's just what the employer could afford, and there are limited medical products that help with the deductible of the plan. Well, you'd want to enable those employees to be able to pre-tax that premium in order to buy that type of coverage. So again, kind of thinking outside the box, employers could still utilize some defined contribution dollars of their own, or for employees to make pre-tax contributions as well to those accounts. Secondly is I have here post-tax contributions could cover any individual medical premium. Some conversations and discussions that we have had with brokers and with employers are, the employer would still like to designate some type of defined contribution dollars to the employee for these premiums. Recent conversation with an employer had said, well, we still want to give the money. We're not going to offer group health plan coverage, but we'd like to give them something. I can't give it to them on a pre-tax basis, but I want to be able to segregate it into an account that the employees know, hey, this is explicitly money for my medical premiums, and as an employee they could contribute more dollars as well. And so what you could do is also think about a PRA, maybe not under the pre-tax light, but look at it in a way to create post-tax contributions into that account. And that could be employer-based and employee-based as well. Again, it's post-tax, so they're going to pay taxes as wages, certainly on those dollars, but it would enable them to kind of segregate those dollars more specifically, or the thought of more specifically, toward premiums. Lastly then, and this is something that I think is extremely valuable here for you all, is what about employers not offering group health plan coverage or have a larger percentage of their employee base as variable hour employees, so more of the part-time workforce? So those employers not offering group health plan coverage or have a large percentage of the variable hours. Something to think about. Those variable hour employees, or those employees, because you're not offering group health plan coverage, they need to all go to maybe healthcare.gov, or if you're utilizing a private health exchange where they can purchase individual coverage, they're going there. But one thing to consider is over 42% of the bronze metal tier plans that are on healthcare.gov are HSA compatible plans. So almost half of those plans are HSA compatible. So think about this. what if you as an employer, so if you're not offering if you're not offering group health coverage and you've got a lot of variable hour employees, what about offering a benefit where the employer contributes to an employee's HSA account, where it does enable you to encourage consumerism? So, for instance, the employer could state, all right, folks, I'm not offering group health, or to my part-time staff or variable hour staff, I'm not offering group health coverage to you, but I'm willing to provide a benefit of $200. $750, $2,000, whatever that may be. I will make a contribution to your HSA account if you enroll in a plan that's HSA compatible. And there's another way where an employer could provide a benefit, and certainly a tax-free benefit, to the employees. That's certainly something to think about as the healthcare.gov is continuing to get up to speed, and more folks are going to continue to look in that direction. All right, moving along here into our next section and understanding the new rules for health FSAs, accepted benefit rules, and we are also going to touch on the rollover provision here between these two. Now, FSAs are actually here, let's go with the question here. Will a health FSA be considered a group health plan and need to meet certain requirements in order to comply with ACA? The answer is yes. And this has been something that has been kind of, I guess, in several different pieces of the legislation been bantered about. And I think with the guidance that came out in September from the DOL and IRS, it really solidified or more cemented the information for us here in regard to health FSA. So this is some important things. I know many of you might sit here and go, well, wait a minute, Steve, whatever, it's an FSA. Yeah, FSA. It's been around forever, right? Yeah. Well, that is true. It has been around forever. But you do need to consider these requirements. This is actually very important. So there's two things that I want to really cover as the key requirements here for a health FSA. Now, I'm not speaking about the dependent daycare account. I'm not speaking in this vein in regard to a premium reimbursement account, just the health FSA, okay, that reimburses the out-of-pocket medical expenses. So the first thing that employer must do is offer a group health plan that is not limited to accepted benefits. Okay, so if an employer wants to offer an FSA, okay, we would love to see more of that, right? So it's a good thing. But the first thing that the employer must ask is, do I offer a group health plan that is not limited to accepted benefits? So a standard group health plan, that complies with ACA requirements. Now, as a subnote there, I note the employee must be eligible, but they don't necessarily need to enroll in the group health plan coverage. So you could have employees that waive coverage. That doesn't prohibit them from being in the FSA. They just simply, they don't necessarily need to be enrolled, but only be eligible. Number two, the second thing or the second requirement that the employer must have in order to offer an FSA that falls under the accepted benefit rules is, number two, must ensure that the employer's maximum benefit or maximum contribution, the employer's contribution, does not exceed 2 times the participant's salary reduction election for the year, or if greater, the maximum benefit can't exceed $500 plus the amount of the salary reduction election. So, and I'm going to describe that for you here in just a little bit, unless your eyes glazed over there as I read that. So, first off, think of this. Many employers today that we have on our books as clients, they do not provide an employer contribution. So as long as they offer a group health plan, they don't have to provide an employer contribution. That's going to be considered an accepted benefit. Okay, it meets the requirements. No issues whatsoever. But what it gets around to is if an employer does not offer a group health plan, they will not be able to offer a health FSA. It will not be considered an accepted benefit. So you do need to consider these requirements as you're talking with employers that maybe if they're small employers, they're deciding not to offer coverage. That's going to push this health FSA or kind of remove the health FSA as a solution for them. Now, Most employers do provide a group health plan. Most do not provide an employer contribution. But let's talk a little bit about if they do. So let's look at a couple examples here that I just put together to hopefully this will solidify it here for you a little bit more. So an example for one, see if I can clarify this. So if an employer decides, you know what, guys, I am going to provide a dollar-for-dollar match. So whatever, for each dollar that you put into your health FSA, I will also contribute $1. So if the employee elected up to $2,500, which is the federal limit. Now, it depends. The employer could have its own limit, okay, up to that $2,500 amount, but let's just say it's the maximum allowed. The employer can also match up to $2,500, okay? So don't get confused. I'd mentioned this $500 number there. So if you recall, it cannot be more than 2 times the employee's salary reduction. So if the employee elected $1,000, the employer could put $1,000, okay? $1,000 is greater than 500, okay? So I'll try to explain this here a little bit further. Let's put it into, you know, we don't see as many employers providing a match, although it's a wonderful opportunity for an employee to contribute and earn some extra dollars in that account. Many employers decide, you know what, I'm going to give you a fixed dollar amount, okay? It's not bearing on what you contribute as an employee, but only, you know, I'm going to give X, all right? So let's say in this example, the employee elects $400, all right, only $400. The employer had set a contribution at $500. In this case, $500 is the maximum, so the employer contribution will be limited to $500. So as you notice here, 500 is more than 2 times, you know, the 400, okay? But under the rule, under the guidance, it could be up to a maximum of $500, okay? Or 2 times or $500, the greater of. So in this case, if the employee elected $100, you could put in $500. If the employee elected $500, you could put in $500, okay? So anything under $500 that the employee would elect, the maximum amount that the employer could put in would be $500. But let's look at that a little bit different. So what if the employer, we've had many questions in regard to, well, we want to be able to contribute more than $500 in the FSA, but now you're saying I can't, or I've created a non-accepted benefit under the ACA requirements. So what if I want to contribute more? So as a solution, what you want to consider is the employer could adopt an HRA that would cover the additional employee's out-of-pocket medical expenses. Okay, for one, you're offering a group health plan, so an HRA that's integrated with a group health plan is going to be considered eligible. It's a permissible HRA plan design. So the employer could place $500 within the health FSA, and then based on the high deductible health plan or the benefits that are being offered, the employer could adopt additional reimbursement through the HRA. Okay, so an employer might want to consider an HRA and an FSA. They can be married together day in and day out. It's a great marriage, I guess, if you will. So those two work together extremely well, and so you can easily create plans within the FSA and HRA that are going to fit the employer's needs. What if you don't comply? Now, in the guidance, they have been very straightforward in regard that penalties will exist for noncompliance. So, for instance, if you have an employer today, all right, in 2014 plan year that is not offering a group health plan, but is offering a health FSA, that's out of compliance. Okay, so they must be offering group health plan coverage or fitting those employer maximum contribution rules. Okay, so what if you don't comply? You do want to look at maybe not necessarily termination, but at least amending the plan. There might be some cases where termination does exist. For those FSAs that are in the 2013 plan year, again, you can continue those plans, but at the end of the plan year, you need to assess it and whether that needs to be terminated as far as a health FSA or just amended to comply. This is a wonderful opportunity. We've said it time and time again for your benefit professionals to be able to go out, talk to your employers, strategize with them, ask them these 2 important questions, right? Do you offer? Find out. Do you offer a group health plan? And ensure that the employer's maximum benefit meets, these specific requirements as well. All right. So let's move on here. All right. So for many of you, I personally have done many enrollment meetings, and our team here at PrimePay has been, we try to be as active as we can in FSA enrollment meetings. And if you picture this, this is what we generally would see within these enrollment meetings. We had people, marching here, remove the use it or lose it rule, and we had people overturning my car as it was in the parking lot during the enrollment meeting. Why? Because of the use it or lose it rule. These individuals and employees have said, you know what, please get rid of it. Do something with this use it or lose it rule. Well, on Halloween, October 31st, 2013, there was a very celebratory mood here within PrimePay, and hopefully for many individuals that are participating in the FSA. But this is how I picture FSA enrollment meetings in the future. Just a lot of happiness that is going on in those rooms. So let's touch here. Well, what was this news? This news was about the $500 carryover provision, or, as we call it here, really just the rollover provision, or the $500 rollover. But let's just discuss some main points. So it is effective. This provision that was announced at the end of October of last year is effective for plan years starting in 2013. Okay, so if you have a client that currently has a 2013 plan year, fiscal year that's still going on here right now, you would want to be in contact with them to let them know that this is something that could be added. Secondly, what the provision entailed in very short order was that it allowed a carryover of up to $500 of unused health FSA amounts into the next plan year. So this did not completely remove the use it or lose it rule. So we're kind of like, shoot. But this is really good news because this enables an employee to maybe stop the guessing to some degree as far as how much they should elect, because now they could elect $500, not even use it in a year, and that money is going to just roll over from year to year to year to year. So a wonderful, wonderful provision there. Thirdly, anything unused over the $500 amount will be forfeited. So we still have this use it or lose it that's still going to be in place up to that $500 amount. Employers may choose to have the carryover provision or grace period, but not both. I'm going to touch on these two here in just a second, but grace periods have been around since I think it's 2005. I believe it was 2005 when that started. I would say the vast majority of our clients had adopted the grace period, which allowed for a short time for money to be rolled over. So what the new regulations had stated is, well, you can have one or the other, okay, but not both. The carryover amount does not count against the participant's salary reduction limit. So the limit, as you know, the federal limit, maximum limit is $2,500 for the 2013 and 2014 years. An employee could elect the full $2,500 if allowed, and the employee could still roll over $500, so it would have a maximum of $3,000 in that next year. So the employee can still elect that full $2,500 regardless of what might be available as part of the rollover. Next, the new provision would not permit an allowable election change for the current plan year. So just because this event has now occurred, it's not permitting a status change or an election change for that individual to, well, I'm going to add another $500. You can't do that. Okay, so we still kind of have that irrevocable election rule, but for those standard events, but this is not one of them. And then lastly, this does not apply to dependent care accounts, okay? So the dependent care account can and may continue to use the grace period if, that was selected by the employer, but the rollover does not apply to the dependent daycare accounts. So just touching on the two together, just pros and cons as we think about the grace period and carryover. As I had mentioned before, probably Wow. I mean, it's probably a good 98% of all employers' plans included the grace period. But just to show kind of what happened here at year end with many employers based on this new information, we had about half of our employers choose the new carryover provision for those employers renewing with us January 1 of this year. So you can see already that employers moved quickly once the regulations came out to add this carryover because they saw this as much more of a value for them versus what the grace period offered. But let's just touch on it here real quick. The grace period, I mean, certainly a positive is there was no dollar limit for money to be moved into that grace period amount. So if it was $1,000, your full election amount of $2,500, the entire $2,500 could move into the grace period, but the con is that it was limited time. There was just this limited time to use the funds. The maximum time period was 2.5 months, and so it really granted that participant an additional 2.5 months to spend down those dollars. But once that 2.5 months was over, any portion of that $2,500 remaining would be forfeited, okay? The carryover, the rollover, certainly the positive is the funds, the $500 or less, are available for the entire next plan year, okay? So regardless of, you know, if it's 200, 500, whatever it may be, that money is available that entire subsequent year. The negative, it is capped at 500. So we are kind of capped at that amount here for the coming year, all right? Lastly, then, just some steps to consider here as we think about the carryover and what you need to do potentially with your clients. So many of you have certainly consulted and advised in regard to health FSAs with your clients, and many of your clients have probably chosen the plans with a grace period. So what you do need to know is that if the employer, under the provision, employers can amend their 2013 plan years and be able to amend those in the current plan. So what they will want to do is amend the plan to remove the grace period for the health FSA before the end of the current plan year. Now, as you think about all plans, okay, so any plan that has the grace period, does not have the grace period, all plans will need to adopt and communicate the carryover provision before the last day of the 2013 plan year. Now, they're going to want to do it well before that to educate the employees on what the rollover is all about. I know here at PrimePay we have created flyers, information that employers can use to educate their employees in regard to what that provision now means. And then lastly here, again, for all plans that are out there, all FSA plans, they will all need or want to amend the plan to add the carryover provision before the end of the 2014 plan year. So all new plans, they just need to make sure that they're amending all of their documents, you know, here in relation to their 2014 plan year. This is a real encouragement for I think for employers and for employees. Again, this does not remove the complete objection, but it goes a long way in kind of removing that so that at my FSA enrollment meetings that we've removed the riots and we're in celebration mode. Because too, think of this, you know, the employer is going to see more contributions. Employees will, since the objection is lessened, employees will be more willing to contribute. And even beyond that, you're going to see a greater level of participation from employees who kind of shied away from it because of that use it or lose it rule in the past. I want to talk briefly here in regard to premium-only plan changes. Again, this was something that came out here in the fourth quarter of 2013. Many of your employers today who at least are offering group health plan coverage or at least ancillary benefits where employees are contributing toward the premiums of those maybe voluntary benefits, what have you, have established a premium-only plan. Okay, a premium-only plan enables or permits that employee to pay for those premiums with pre-tax dollars. Okay, so what is required? So what I want you to look at are plans that renewed in 2013. This was a one-time special enrollment period granted as transitional relief by the IRS. Okay, and this was for the 2013 kind of plan years. So in looking at the questions above, if someone is enrolled in group health plan coverage and then elects to go to healthcare.gov, let's say, to enroll in coverage, are they able to drop the group health plan coverage? Is this a qualifying event? As most of you know or are aware, under Section 125, but for specific status events or qualifying events, you have the irrevocability rule in changing elections. Once you've established it, you're going to keep it, okay, but for those events. So this transitional relief focused on a couple options here. A here, employees may prospectively revoke or reduce their group health plan coverage elections. So the IRS has granted relief for those employees who want to get off of that group health plan coverage in order to enroll under, say, healthcare.gov and go after that coverage. And secondly, B, employees who did not elect the employer-sponsored coverage for the 2013 plan year may enroll in the group health plan and make new prospective pre-tax elections. How about that? So A and B are both pretty big deals, and you want to think about that, how your employer has adopted, or as far as the documents go, in looking at the premium-only plan documents, employers will have a choice to allow this option. Okay, so this is actually something that is an employer choice, which I find a little amazing, but it is. So it's employer choice. And the employer can choose which plans will be eligible. Now, I want to put this one caveat out there first, and it might be something that you want to connect with your carriers, but check with the carrier's policies first on this. Now, I would say that most carriers will permit it, but you do want to check maybe first before the employer adopts this one way or the other. So if the employer wishes to adopt this, in essence, allowing the employee to do one of those two options above in A and B, amendments will be required for the documents to place that new qualifying event language, status event change language, within the documents. And again, this is a one-time special enrollment period here for the 2013 plan year. All right, so just please make a note of that here, but we wanted to bring that at least to you. So as you think about what has been going on here over the last, well, now I can say several years, it seems like every Friday there's new regulations, coming out, more information to read, and I guess a lot of times, I guess this is maybe a picture of me, but I feel like, man, that ACA compliance stuff, it's all over me, all over my back. I've got to somehow get a handle on it, get a grips on it, and at PrimePay we've taken some hopefully some very good pride in trying to stay ahead, certainly, of that curve. So as you think about some next steps, I mean, I've provided you here today with a tremendous amount of information, all right? But we always try to bring it down to a practical basis, and I hope through the solutions that I've delivered here today that has really helped to take what is maybe a no and turned it more into an opportunity here for you. So just thinking about some next steps here. HRAs that are not integrated. Let me digress just one second. You also have a real opportunity due to all of these requirements in sitting down with your current groups and certainly as you prospect for new ones to sit down and really act as a consultant and advise, help them with their due diligence of complying with these requirements, and we very much want to try to put you in that driver's seat to be able to do that. So one of those key discussion points is talking with your employers. I mean, if they're deciding to offer or not offer group coverage, you need to look at HRAs that are not integrated with a group health plan or is not providing some type of an accepted only benefit. You are going to want to advise them that you need to spend that down or need to terminate that specific plan here at year end and refocus that based on the specific solutions that I might have mentioned here today. FSAs. Please don't kind of gloss over the FSA piece. It does need to comply with the ACA requirements. So choices that are made with that employer and the group health plan can clearly alter what may be available through the FSA. So if you just take out that employer contribution, but you focus on, hey, does that employer actually offer a group health plan? Okay, health FSA, you can do that all day long, all right? But you definitely need to ask those questions and determine exactly what that employer is doing. PRAs, the premium reimbursement account, at this point in time, unless further guidance comes out this Friday, but they cannot reimburse individual medical premiums only for those accepted only benefits. So again, I wish that was another direction, but clearly, at least right now, to hopefully reduce the confusion, PRAs cannot reimburse individual medical premiums. And then lastly here, the FSA carryover provision is absolutely historic, and it will increase participation and contributions due to this provision. That will increase the employer's FICA savings. It will increase the tax savings for the employee. And think of this as well. Employer plans and individual plans are only creating more out-of-pocket expenses for the employees. And so as an employer, they should continue to find easy types of options to allow their employees to contribute to something on a tax-favorable basis and be able to pay for those expenses with pre-tax money instead of after tax. And now with this rollover provision in tow, it is a great opportunity to really drive the participation and contribution. So right now is your time to really drive some education there, maybe reintroduce the FSA to those employers, because clearly we can gain some traction there with that. Keep your eye on the solutions. As much here as we talk about issues and challenges and all of that, right? I mean, it seems like we get faced with that a ton. There's plenty of solutions, and we certainly will hope to continue to provide the opportunity for you to better consult and advise your clients. So let me ask you, in order to, at least for helping maybe PrimePay here today, I have one question that I would like to send off to you. I have put it in the form of a poll question. And I would ask each of you to just head to you're already there at your computers, but I will want you to look there on the screen. I have posed a question. And the question, as you see it there, is in 2014, out of the following solutions, what do you think your clients are going to value the most? So as you guys, many of you know PrimePay and kind of our solutions, but also you know your clients. So if we were to look at these 5 kind of items, if you will, go ahead on the screen and just provide us with your top 2 picks. Your top 2, what you think your employer groups would most value here as we go into 2014. And this is something that we want to continue to look at so that we are creating and driving stronger and stronger solutions for you. And so we wanted to ask this question, and you guys are doing great, providing me with, there's a lot of information. I'm just going to let it go here for another few seconds here, and then I'll close the polls, and you can kind of take a look here and see what everyone had voted. Let me just get up here till we get a good amount percentage-wise. You guys are doing great. I'm going to close it here in just about 5 seconds. So get your votes in. Again, just the top two there. All right. I'm going to close the poll, and I'm going to share it. So take a look here. So we've got, looks like the majority, at least the top 2 choices there were the private insurance exchange that employers might be looking at, but also a continued a movement here toward FSA, HRA, and HSA benefit accounts. They clearly, even with all these challenges, really still offer such a valuable tool and solution for your employers. Thank you for responding in that way. This, you guys have submitted a tremendous amount of questions, and for that I am grateful. What we will do is put that together in a Q&A. In our follow-up to you, look for that here in a couple days. We usually try to get it out by the Friday following. So on Friday, we will get that information off to you, and so you'll have it and a lot more information to help you with some of the information shared today. We are excited about 2014. Last year, we introduced CE webinars. Last year, we hope to actually, hopefully we could double the amount of CE-based webinars that we had done here or are going to do here for this year. So look for details to come. I believe that our first CE webinar will be in March, so the first Wednesday in March. Our next webinar is scheduled for February 5th. And it's going to be on how to make ACA reporting easy. Now, we're not going to do the easy button, okay, but we do want to talk about some specific requirements clearly that the employer mandate is going to drive, but we want to try to help you with that and understand how to make it easy, not only for you but for your client. So we hope you can join us. So that will conclude our webcast here today. Thank you so much for joining us. Happy New Year to you, and we look forward to your next visit with us for our next webinar here in February.